Imagine being a kid and spending months working to overcome a mental health crisis. The darkness has lifted and you are thriving and the future looks bright, or does it? Earlier, we shared with you the many challenges that mental health professionals face when trying to help our kids. And now we hear more on what they say needs to happen in order to better serve their mental health needs. Staffing shortages, a lack of facilities, insufficient funds. The barriers to addressing the youth mental health crisis are endless. Another hurdle often encountered when kids enter treatment facilities for mental health is where will they go upon discharge? While a number of kids who are admitted to facilities such as Pride Manchester House are released to family, not all kids have family or a place to call home. In the past, these kids would often transition to a quality residential treatment facility, or QRTP. Then, in 2018, the federal government enacted the Family First Prevention Services Act with a goal of increasing the number of kids who can remain safely at home with family. Mandy Ferguson is a registered nurse at Pride Manchester House, and she explains that in North Dakota, the goal was to place fewer kids in QRTPs and more kids with foster families.
North Dakota tried it out, and it's not working very well because we had to close down a lot of our facilities. You know, they want to try to keep the kids out of facilities and more in homes, which is challenging because some of our kids just aren't able to maintain in a home. They have a lot of very high needs.
Staff at Pride Manchester House yearn for a wraparound approach when it comes to discharging kids from residential treatment, especially for kids who don't have a place to call home. Winterberg says that most youth do fairly well in the program, but when there's no foster home for a child to go to upon completion of the program, the outcome can be drastically different.
That's when those youth get that sense of hopelessness, and they kind of actually regress. A lot of times we'll go back to maybe 4 months ago when we were just starting some of the treatment.
The typical length of time spent in a residential treatment center is 6 months, but Ferguson says some kids stay upward of 10 or more months when they have no foster placement. Eventually, they have to leave, but where do they go? Winterberg says they don't always know. It's an occurrence that Dr. Damon has also witnessed countless times.
I've talked with social services all the time. You know, they've even had, the position where the social services had to, have the kids stay in the office overnight with them so that they can, they had no other opportunities. There's no foster homes. There's nowhere else to have the child go. So these social workers, I feel really sorry for them. They've had to do that multiple times.
Dr. Damon says it's crucial that the state of North Dakota increases the amount of services and emphasizes the importance of coordinating these services and agencies.
Extra counselors in school we dramatically need. We need some group homes that are back. We need a state hospital that's functioning at this point. We need a clear transportation system. Again, if we cannot serve a child in this hospital, to make sure that all the needs are met at this point, and then smooth transitions, again, between the different levels of care.
Those resources all require money, but many don't see that as an issue here in North Dakota.
The state has excess amount of funding, so it's not like we don't have the funds to do it. We can do this. If we don't do this, what's going to happen when they become adults? In other states, again, there's a lot more services that are available. We have a budget surplus. I mean, what do we need to save up for? To have it balloon up even more? Well, spend it on the kids. I mean, they need the services.
And finally, family therapy and preventative services.
It costs a lot less money to do the primary care services than it does to try and pick up the pieces in the long run.
We have the desire and we have the ability to do well. I think it's just coming down to the appropriate resources.
Staff at Manchester House say that their dream would be to build a larger facility with more beds and more employees and a big gymnasium, and with that to broaden and offer more services. And so there's a lot happening there. And in the coming weeks here, I'm going to continue looking into this, and I'll bring you more on what the state and North Dakota schools are actually doing and what they hope to do in the future to continue to address this crisis.
Yeah, I can't imagine the hopelessness. I think that's when it gets dangerous.
Exactly.
For kids.
It's so different for every kid. And nationally, I know that there's been a lot of statistics and data taken on the number of kids who are suffering more now since the pandemic. And, that data hasn't been collected necessarily in North Dakota, but it's just, you can assume that things have worsened, and so making more services needed.
Yeah.
So.
Well, great that you're raising awareness of this.
All right.
Thank you.
Thank you.